Nothing short of a nightmare in Xi Jinping's China as the country is facing a massive surge in cases due to the emergence of an Omicron subvariant BF.7 that is slowly becoming the variant of concern across the world. The situation in China has sparked alarm, especially in India, with the center keeping a close watch. Let us first tell you what is happening in China. Video after video is coming out from across the country showing packed crematoriums and hospitals. These videos tell you about the grim situation in China with the danger of millions being infected by the latest wave. And as China battles the latest variant, reports from the country suggest that another brutal clampdown is underway. People are being forcibly detained in isolation wards in Shanghai. But as these alarming pictures and data and stories emerge, is India prepared? Is India going to go down the China route? The answer appears to be yes, India is very prepared, and no, India has nothing in common with China. About 96% of vaccine administered in India are Covishield and Covaxin, while China administers the CoronaVac and Sinopharm. Now Covishield has a 76% efficacy compared to just 60% of CoronaVac. Covishield is also 67% effective for the 80+ age group compared to just 30% efficacy for the same age group in China. And when we talk about herd immunity, India has much higher natural immunity compared to China because of its strict lockdowns. Remember, India recorded over 45 million cumulative cases compared to only 2 million authorized cases in China that were announced. That equates to over 32,000 cases per million people in India compared to a little over 1,300 cases in China per million people. And also remember that the BF.7 variant is a subvariant of Omicron, a parent variant that was behind a spike in cases in December 2021, which means India is likely to be better prepared for the spread of this subvariant of Omicron as compared to China.
You're watching the News Hour at 10, debate number 2 on Times Now, Super Prime Time.
So is there any real substance in the comparisons that are being made between India and China? What really is the nature of the virus that is currently running amok in China by all known facts so far? Joining us now is Dr. Shekhar Mande. He's the former DG of the Council of Scientific and Industrial Research. And also joining us is Dr. Li Mengyan, who's an independent virologist. So I want to start by asking you, what do you make of people saying that going by past trends, the virus could reach India in 5 months from China? What do you make of this rumor / hypothesis?
See, the virus is already here. We have seen some positive cases in a few states. And as we know that this mutant is extremely transmissible, so it is likely that it will come here sooner than 5 months than other countries. So because of the R number, R naught of the virus is very high, it is quite likely that it can come here. But at the same time, we don't need to panic about this, as what everybody has been saying, and we'll come to that a little later in the discussion.
What about the fear that it could mutate further and also become fatal?
So if we see the history of all the viral diseases, my co-panelists will agree that in the early periods of pandemics, I mean, if you take the example of, for example, 1917, 1918 influenza, global pandemics, in the initial period, the pandemics is very deadly. Many people die of the virus, and the virus, as it mutates, it becomes milder, but it is much less virulent than what it was actually in the early period. And that's the trend that we are also probably seeing in terms of SARS-CoV-2, that the initial period, the mutants that arose, they were very deadly, but as people developed immunity and as people became vaccinated, probably we are seeing lesser mortality now than in the early phase of the pandemic.
Dr. Yan, you've been very vocal and you've been tweeting a lot about what is happening in China. I want to start by asking you about one of your tweets where you seem to suggest that this is a bioweapon. The latest virus in China is a bioweapon. What's the basis of that?
Actually, from the origin of the virus, it is bioweapon. It is novel bioweapon made by People's Liberation Army, and I insist on that with evidence from the beginning of 2020. Now you can see the House Intelligence Committee of US, they already published the report that there are evidence which is downplayed to show that COVID-19 virus is connected to the bioweapon research in China, and also they're going to hold Chinese Communist Party accountable. So based on this, from the beginning, COVID-19 is bioweapon, and also the mutant, which was already shown, can be generated in the lab. So since China has already gained a lot of benefits from the pandemic, we always need to be very suspicious about the new outbreaks. And here, a lot of things suspicious happened in China. That's why I want to remind people of that.
Why would a government want to release a bioweapon on its own people?
There are so many reasons. The first thing is I always said what happened in Wuhan was out of control. It's because they underestimated the transmissibility in 2019. But now this time, what we see is during the right after the pressure from the China inside, and also when the international pressure hold to China to hold it accountable, there are a lot of motives. I was born in China. We Chinese people never thought this government can harm their own citizens. However, about this outbreak, even we still don't know whether this is the intentionally again released to the citizens. We already see other evidence show that the government intentionally made this outbreak worse by controlling the treatment, and also they suppress the sequencing of virus to the patients, which we even don't know what is circulating in China. And also they let this outbreak enlarge all over China. These parts are all man-made.
Dr. Mande, if this virus isn't that deadly, if it's not so fatal, then what explains the kind of images we're getting out of China? Why are people dying in such large numbers there?
Yeah, so when I said not fatal, it's not fatal because of multiple reasons in certain countries, like let us say India. Because the large population of India has already been doubly vaccinated, and substantial population also has received the booster dose. That's number one. Number two, our Delta wave that came in April, May 2021 was so severe that many people across the country were infected by it. So if you look at the sero survey, national sero surveys undertaken by ICMR and CSIR then, it appears to have suggested that large fraction of Indian population had already been exposed to the virus. Now, because of these two reasons, the Indian population has developed some sort of an immunity to the virus, and therefore the mortality in India is probably going to be less upon exposure to the new variants of the virus. You have to understand that in this particular disease, when the virus enters our body, it first starts replicating, and about 5th or 6th day, the viral load in the body is about highest. And slowly it goes down, or by something like 8th or 10th day. Right? I mean, this is for normal individuals, not the immunocompromised individuals. Let us not talk about the immunocompromised or those who are cancer patients or something like that. So, however, on the 8th or 10th day, around that time, something unusual happens, that our body's hyperimmune reaction actually starts against the virus. Hyperimmune reaction, what we actually popularly call a cytokine storm. And most people have actually died because of this cytokine storm. And at that time, actually, we develop pneumonia-like symptoms. Our lungs actually capacity goes down, and we start falling short of oxygen. Now, that hyperimmune reaction is unlikely to happen if you have had prior exposure to the virus or you have been vaccinated. So, although you might get infected by the new strains, your body may not actually hyper-react to the virus as actually what happened in the early stages of the pandemic. On the other hand, in China, what we are seeing is because large fraction of people have not been vaccinated, and because large people have not seen the immunity, hybrid immunity, what we talk about combat contact, it is likely that China's mortality might actually be higher in this particular way than other countries.
What about projections that 10% of the world population could be infected within the next 1 or 2 months, Dr. Mande?
Quite likely, because as I said that this virus is highly transmissible, its R0 is very high, and therefore large fraction of people could be infected. But infection does not necessarily mean it will lead to deaths.
What about people who are immunocompromised, sir? For example, those, like you said, are cancer patients or pregnant women. Could it be fatal for them?
No. It need not be fatal to them. In the immunocompromised patient, what happens is that because the body's immune system is compromised, the virus tends to stay in the body for longer time. The immune system does not clear the virus from the body. And therefore, virus incubates in the body for a much longer duration than about 10 days. And then there is a chance that virus would mutate as it replicates in our body. And that's why the new mutations that arise, the new strains that arise, are probably from individuals which are immunocompromised. That's what our hypothesis, and most of the world accepts right now.
Dr. Yan, does China have enough medicines for its people now?
China now government control and suppress the medicine supply to people. We have seen a lot of the statement or internal information from China that government don't allow the pharmacy to sell the fever medicine or painkillers to the citizens, and also they don't like the hospital to give prescribe to the patients. This is very evil. And also what we want to say is back to China, we have a very high coverage of vaccination. Although it's not the vaccine you use in India, but based on the China CDC's data in July, they have already over 90% of Chinese people get 2 doses of vaccination, and elderly had over 80% coverage. However, we don't know what new variant will come out after this big outbreak in China.
So you have over 80% coverage. Despite that, China is seeing this kind of morbidity, Dr. Mande. What does that say about the efficacy of the vaccine?
See, that's one of the problems that we have always struggled from the beginning of the pandemic. While the rest of the world was very transparent about the vaccine trials and all, and the trials of including our Covishield and Covaxin were published in peer-reviewed journals, so people actually got to see the data and assess for themselves how effective or how the efficacy of these vaccines are. Well, the Chinese 2 vaccines, we really haven't seen the numbers, the clinical data on the trials of those vaccines. And that's a matter of concern for most of the scientific fraternity around the world.
Do you think that's still a big challenge, Dr. Yan? The fact that the vaccines which are being used by China don't really find takers across much of the world, given how opaque they've been about their vaccine trials and efficacy?
I studied vaccines at WHO reference lab for over 5 years. I can tell you, first, the vaccines used in China is not efficient at all. And also, there are a lot of side effects. Actually, this inactive vaccine was proven fail during SARS-1 period, but they were given to Chinese people now. And now we also need to say, although the other country people get mRNA or other vaccines, but it already shown the effectiveness against the new variant in the past 3 years are also not that good. So we need to also be aware of whether the new vaccines you booster or get can protect you from the new variant. So I always tell people that when you see the good data from peer-reviewed journal, you always need to ask the data they didn't let you know. Not only neutralizing antibody titers, you have to ask them what side effect during long-term or boosting or the animal experiment. Unfortunately, we haven't seen enough data, but I want to tell people we have drugs. You always need to remind of that.
Dr. Mande, you know, I also read today morning that this particular variant has been around for the last 6 months across several countries. I'm just curious, how did we suddenly go into this panic mode? And it's literally happened over just the last 5 days. If this virus, this variant has been around for 5 months, then why are we suddenly waking up to it now?
Actually, what happened in the last 5 days, there is one development that took place, that certain people had done modeling of how the disease is going to grow in China. And the numbers that were projected by this particular group were very scary. And in fact, these particular predictions actually say that China could lose up to 1 million people in the coming weeks to the disease. And that actually scared most people out of this particular variant. Although this variant has been around, as you correctly say, for some time, and the variance R0 is very high, But yet, because of the multiple problems that we discussed just now, multiple situations in China, it is spreading very fast. And perhaps it is not spreading as fast in other countries as what we discussed just now.
It also has a lot to say, final word from both of you doctors, starting with you, Dr. Mande, about how we have conducted ourselves over the last 2 years in terms of our vaccine, our medicine and our system vis-a-vis some stronger economies and larger countries.
I think our the tackling of the disease is a model for the rest of the world, including the most advanced economies. The Western media has not acknowledged the fact, but the fact that we had early lockdown in March 2020 was to prepare ourselves for all our diagnosis, our apps that were getting ready for testing, tracking individuals. Our Kavach was ready by then, and very soon COVID became available. We put our diagnostics in place, and then we slowly, gradually opened up. There's a massive public campaign on use of masks, on avoiding crowding, on washing our hands frequently. This has been, I mean, there's unprecedented in any other country. The amount of campaign that went in India, starting at the top level, topmost level, everybody on TV was saying that please keep distance, please use masks and all those things. And then very rapidly we were able to get our people vaccinated. There's another model for the world that how quickly we were able to distribute 2.2 billion doses, unprecedented in history. So we could actually do that even in the remotest corners of the country. So the entire thing, how India has tackled the pandemic, is actually a model for the rest of the world to follow. I bet WHO should come around and start saying that Indian model is actually the model that other countries would follow in future pandemics.
As an independent expert, Dr. Yan, what's your view on that? A comparison when people compare India and China and predict that India could soon be following in China's footsteps in terms of fatalities.
The first, I don't want people get panic because panic doesn't help. And also, you have already seen the pandemic in the past 3 years. And yes, we don't know what is circulating in China now. When they claim this is BF7, it was 1 month ago, and now China suppressed the viral sequencing. However, I believe that if India can be vigilant, the government can help to reinforce your medical resources with the medicine and also the health instruction and also the workload. So this would all be very helpful. The thing is you should not just enjoy the holiday and forget the danger. And one more thing I want to remind, China will reopen right after this new year. And at that time, you have to expect that there is most likely new wave hit all over the world because the variant will come out too. And at that time, I think how to insist on your successful experience in the past 2 years and improve would be most important.
Dr. Shekhar Mande, Dr. Lee Meng-Yan, thank you both for joining us with your wisdom, your expertise, and most importantly, your reassurances. Stay calm and listen to the people who matter the most, those in authority and, of course, doctors. Thanks for watching.